People with disabilities are used to facing obstacles. As a group, they often struggle to access tailored education and are more likely to fall into poverty. Yet their experience is far more widespread than you might think. 15% of the global population has some form of a disability. As people age, the experience becomes more common. Nearly half of those over 60 are disabled. Among children, it is 1 in 10. For many, especially in developing nations, the pandemic has made things all the more challenging. Overstretched healthcare systems and lockdowns mean many of the services they rely on day to day have disappeared. How has COVID-19 affected this diverse group of people, and what can be done to make sure their needs aren't neglected? Welcome to your COVID-19 special. I'm Chris Colbert in Berlin. Now, it doesn't come as a surprise that people in need of special care are facing extra difficulties during a time when healthcare systems around the world are stretched, sometimes beyond their limits. But the pandemic is taking its toll on people with disabilities on several fronts. Here's one example from India.
Samir Khan was just 10 when he was first diagnosed with spinal muscular atrophy, a rare genetic disorder that has a crippling effect on his whole body. It means he needs help from others for all of his daily activities. But despite his condition, Khan founded a garment factory in Delhi's Madhepur district. It took him 3 years to set up the business and to establish trust with his clients.
They
had some hesitation in working with me, but I was confident. Others were not. To win their confidence was the biggest challenge.
But then there was another challenge. The COVID-19 pandemic led to a nationwide lockdown. The local market where Khan sells his wares shut down. And even now the lockdown has been lifted, business has failed to pick back up. People with disabilities are among the worst hit as a result of the virus in India. Many have lost their livelihoods and face financial difficulty, particularly those working in the informal sector, according to a study by an Indian disability rights organization.
You're talking of a situation where everybody is impacted, right? And people with disabilities will just be that much more impacted, almost 3 times as much. Women with disabilities will perhaps be even worse. Without data and without intent and without political will, it's going to be a conversation that ends here.
Most of Khan's workers have not returned, and he was forced to sell off half the machines in his factory. Khan fears a second wave of the virus could mean the complete breakdown of his business.
We risk our lives doing business, but I can't sit around doing nothing for a very long time. I have to work to fulfill my financial needs.
The garment factory was a means for economic self-reliance for Khan. He wanted to employ and support people like him. But today, and for the foreseeable future, the factory will remain empty.
This pandemic is challenging on so many levels. Let's get more from Jane Buchanan. She's the acting director for disability rights at Human Rights Watch. She joins me via Skype from New York. Welcome to the program, Jane. We are talking about a very diverse group of people here, now facing a whole array of challenges. Which part of that group are you most concerned about during this pandemic?
We're especially concerned about the most marginalized among people with disabilities, and that includes people who are segregated and locked away in closed institutions for people with disabilities, psychiatric hospitals, as well as the hundreds of thousands of people around the world who are chained and locked in prayer camps and other types of institutions, bound by chains, unable to leave or access any services whatsoever.
And how has the pandemic been impacting the care for these people?
Well, people with disabilities around the world, all types of disabilities, can face a lot of barriers in accessing healthcare. And that includes even just basic things like accessible transportation, because if you can't get to your doctor or the hospital, there's no chance to even get care. So many of the obstacles that people with disabilities already face in their marginalization are just amplified with the pandemic.
Jane, is there any indication that people with disabilities face greater health risks from COVID-19?
Well, that can certainly be true for people with certain types of disabilities, where COVID-19 infection could create more complications. But again, people who are lacking access to health care, often people don't have the information they need about COVID-19 because governments aren't presenting it in an accessible way. So the materials aren't accessible to people maybe with intellectual disabilities who benefit from a different type of language in communicating about these things, sign language interpretation for television broadcasts and messages about the pandemic and how to protect oneself, where to get care.
Now, you mentioned that you're most concerned about people being locked away in institutions because of their condition. Do you see that the danger, that the concerns and needs of these people on a state level are being neglected now that societies are eyeing the vaccine and try to not catch the virus in general?
Well, we're extremely concerned about people who are basically already forgotten by society, ignored, as you said, locked away. They've been left, in very precarious conditions for the entirety of the pandemic, in close contact with other people, and without the opportunity to socially distance. And so, yes, I mean, even as societies begin to really take steps with the vaccine to minimize the impacts of COVID and hopefully reduce infections and deaths, governments really can't forget those who are most at risk, most marginalized. And people who are locked away shouldn't be there. They should be out living in the community with the supports they need. And that would be and also a really urgent step that government should take at this time to protect those groups.
Which countries are you particularly concerned about and why?
There's so many different situations around the world. It's really impossible to pick one or another country. I mean, I think at this point we're concerned about equitable vaccine distribution among lower income countries and middle income countries, for all of those people. But again, especially people with disabilities or others who really may be left out of those of the vaccine distribution early on. But around the world, we see, people who are already lacking access to the economic markets, are more likely to be unemployed. The economic impacts of COVID will be long-lasting and deep in many places, and there needs to be really extra efforts on the part of governments to ensure that quality and accessibility for people with disabilities. Otherwise, they risk even greater poverty and isolation as the economic impacts go on.
Jane Buchanan of Human Rights Watch, thank you for your thoughts.
Thank you.
And now it is time to take a look at some of the questions about the pandemic you sent us. And as usual, our science correspondent, Derek Williams, stands ready with the answer.
Can you get vaccinated if you had COVID-19 but were asymptomatic?
The messenger RNA vaccines now being approved for emergency use in a number of countries were tested on tens of thousands of volunteers. And it's thought that between 5 and 10% of them had actually had COVID-19 before those trials. And there were no reports of serious adverse effects among those test subjects. Also, in most other diseases, there aren't mechanisms that would cause someone who had them once to react badly to subsequent vaccinations. Many experts have said they think that with COVID-19, vaccinating someone who has already had the virus will act like a booster shot, reminding the immune system that SARS-CoV-2 is still around and possibly even strengthening and reinforcing the immune response. So if you had the disease already, whether symptomatically or asymptomatically, the current consensus is that getting vaccinated should be safe and maybe even beneficial. But that raises another question. If you've had COVID-19, do you need the shot? Well, from what we've seen so far, in the vast majority of people, a natural immunity to the disease after an infection lasts for a while, at least for several months. And while boosting that with a vaccine makes sense, don't forget that supplies of vaccines will be critically tight in the short term. That means it's likely that many governments will probably tend to bump people who've had the disease more to the back of the line, assuming that they're simply in less danger than someone who's never been exposed. But eventually, when supplies of vaccine are sufficient, I assume experts will recommend them for almost everyone, including those who had COVID-19 and recovered.